Well, there's a familiar sound for anyone who's had their heart rate checked. 80% of Canadians have at least one risk factor for cardiovascular disease, and heart attacks and stroke are two of the three leading causes of death in Canada. Each year, heart disease costs our economy more than $20 billion. Well, heart conditions are usually treated with medication. But now, new research reaffirms that doctors should be prescribing something else, too, a healthy dose of exercise. Here's the CBC's Kim Brunhuber.
Come on.
Make no mistake, Bob Goldberg is tough, infantry tough. He spent almost 2 years in the jungle fighting the Viet Cong. But exercise? No thanks.
Exercise reminded me of when I was in the military with a drill sergeant.
A couple of months ago, you never would have caught this 72-year-old on a bike. Now he's literally pedaling for his life.
In the beginning of May of this year, I had a heart attack.
In order to prevent another one, his doctors prescribed something he expected, medication, and something he didn't, exercise.
It improves blood pressure, sugars, cholesterol. These are all things we try to do with medications.
Now, after 5 weeks,
My blood pressure was lower after I exercised than before I started, which was totally amazing.
today, a paper in the British Medical Journal assessed more than 15,000 people who had heart failure, heart disease, a stroke, or diabetes. They found that when it came to preventing death, exercise was just as good as drugs. The study didn't examine what kind of exercise works best, but past evidence suggests regular cardiovascular exercise is the key.
And that equates to about 30 minutes, 5 days a week. And right now, about 15% of the Canadian adult population is meeting this guideline.
Yesterday, Ruth Morrison made a deal with her doctor. He wants to put her on insulin. She wants to get her blood sugar down, drug-free.
He gave me another 3 months to do it.
3 months to prove what the research suggests, that her prescription is as effective as his. Kim Brunhuber, CBC News, Toronto.